what are the precautions you have to take in case of prostatic hypertrophy? The first one is restrict taking fluids when you are going to bed. At least for 3 to 4 hours before going to bed, you should stop taking fluid, so that you will not have any sleep disturbances, or you will not be waking up in the middle of the sleep for voiding urine. So, and do not hold the urine for a very long time. So if you hold the urine for a very long time, your bladder muscle get damaged and hypertrophy in the bladder muscle. This causes permanent urine retention. That is the reason you should not be holding urine for a long time, and you should be voiding as early as possible. Do not use antihistamines. Antihistamines causes narrowing of urethra, so you will have more retention symptom. Antihistamines you will be using for common cold or allergies or asthma. So don't use these kind of medicines when you have prostatic enlargement. And also, with cold exposure, when you are exposed to cold, what happens is there will be pooling, or there will be congestion of blood inside the organ. So what happens is, when there is congestion inside the prostate gland, so the prostatic urethra will be narrowed and it will be compressed due to flow of blood. That is, these are the important things you have to take care. And coming to other things, take healthy diet, take low carbohydrate diet, take good amount of proteins, good amount of medium amount of fats. You have to take food with this high in fiber, rich in minerals and rich in vitamins, and also take adequate amount of water. So take a lot of probiotics, and take organic foods, plenty of fresh fruits you can take unprocessed foods. So less frequent intervals of food is recommended, and also you can do fasting sometime. So fasting is very good. And also, do not take GMOs, genetically modified organisms, or artificial sweeteners or artificial colors. So don't take all these food. Reduce the amount of cereals and millets, because these contain high carbohydrate. Take plenty of pulses, pulses in the sense sprouts. You can take plenty of vegetables, seeds you can take, nuts you can take. Reduce the fruits when you are above 50 35 years of age. You can take meat, you can take eggs, spices, and also fats and oils. You reduce the saturated fats in the sense those are present in animals. Other than fish, you can take plenty of fish has no problem, but fat of other animals. And also, don't go with refined oils, always use cold press oils. And ensure that you have 7 to 9 hours of sleep, so that every organ, especially prostatic hypertrophy, will also be in control, and your hormones will be in our control when you have 7 to 9 hours of good sleep. And also, do good amount of exercise. You can do zone 2, zone 3, and zone 4 cardiac exercises. You can do strengthening exercises, power exercises, speed exercises, endurance exercises, both short duration endurance, mid duration endurance, long duration endurance. You can do all these kinds of exercises. And coming to lifestyle, try to be as stress free as possible. So live in a pollution free area, and also live very close to nature.